So I just wanted to share a thought before I lost that thought. I was talking with a really good colleague who does a lot of mentorship in our profession. And the concept of, and actually this is another therapist, good friend and patient and colleague of mine as well. And the concept of sometimes we have patients on our caseload for a long, long time. And as my practice has evolved, and as the theories of trauma and injury over a lifetime, and the concept of compensation, and again, things that we're dealing with have been there a long, long, long time. And the body has created and adapted for a long, long, long time. And again, I tell all my patients, when you come to work with me, this is not a quick fix. Again, yes, there's back pain, or yes, there's some GI trouble, but this is not a quick fix. This is, let's understand what symptoms are. Let's understand what's happened to the body and why the body has adapted, or what is causing strain, or what's behind these symptoms, what's behind this area, and again, what's the bigger picture of the whole system. So I think as this subsect area of our profession evolves into more holistic, more whole person, multi-system treatment, I think it's important to discuss that concept. And absolutely, insurance companies, right, they put the pressure on. You have so many months to complete the work, or you have so many sessions in which to complete the work. But as I look at some of my patients, and again, complicated, I don't like the word chronic, but chronic is a long time. And again, when you've had multiple car accidents 20 years ago, and no one's addressed those direct impacts from a steering wheel or rotational forces, again, a lot of symptoms have been addressed, but those original impacts, those original forces that the body has absorbed have not been addressed. So just for example, I work with a woman in her early 70s, and she's on disability because of the magnitude of many car accidents, whiplash, pain, lots of pain, and vertigo, dizziness, just lots of head injury, sequelae from many, many car accidents. And they're not going to go away in one treatment. They're not going to go away in two treatments. And again, the magnitude of the injury and the damage, like, she might never be 100%. We might not be able to restore things to 100%. However, the gains we make, and as we each time take strain off the system, we give the body an opportunity to restore some of its functioning. Again, taking tension off the system so the body can figure out or have better opportunity for pathways or blood flow or vascularization. Again, neuroplasticity, that's there. We know that the brain can develop and create new pathways. And I believe, right, as we restore vascularity to an organ, we can enhance the health of the tissue. Can we, and absolutely slow down the degenerative disease process, for sure. So again, back to this case. Again, I work with her once a month, and we're probably going on year 2. And while the changes are not ginormous from session to session, as she goes back and looks at, wow, look at where I was 2 years ago with regard to function, and the dizziness, and the vertigo. Again, symptoms still come and go for her. Some are more prevalent than others at different times, but when you look over a long period of time, how far this woman has come. Now, this brings us to another question as we work in the area of cognitive decline and that disease process of Alzheimer's and some of those others. Again, how do we measure we're making change? In my practice, like, as I look at my patients, quality of life. And again, it's all about, how are you doing? How are you feeling about treatment? How's your quality of life? And I think it truly is and can be difficult to capture measurement-wise or in a scale these changes in quality of life, especially a couple things, right? Everyone is so unique and individual in who they are in their environment and what's important quality of life for them. But as we had that conversation on how do we track improvement of quality in life, my patients, absolutely, yes, I feel the changes, I feel the differences in my body, in my emotions, and in my quality of life, but to document that. So, and perhaps back to that concept as we talk about neurodegenerative, again, we were talking about the MOCA and how as we work with patients, that degenerative process is still going on. However, what we feel in our hands, the changes that we're feeling, they're small. So perhaps they didn't reverse the MOCA, they didn't reverse the data. However, the question, we asked two questions. Again, how do we capture those changes in function? Again, we feel some improvement in our hands. Is that enough? Is that worth it to correlate into improvement in quality of life? I saw it in my mom. I see it in my patients. Again, it's small. So how much improvement is significant and worth it? And then the other thing we talk about, especially in progressive neurodegenerative processes, or even, all of us in a way, right? We're aging. So there is kind of an over time a degenerative process, whether we like it or not, which again is another conversation as far as like how's the nutrition we're putting in our bodies, like how fast that degeneration occurs, where it occurs because of past trauma, genetics, all those things, right? So, but what is the cost, or what if we didn't do anything? Again, this was this conversation with my colleague as we discuss Alzheimer's and neurodegenerative, and I think about my mom. What if we didn't do anything? How fast would that disease progress? What would quality of life look like? So, just really important questions for us to discuss and talk about. Again, not quick fixes, right? Again, our medical systems, and we're taught to make pain go away, or some things we're not even taught that we can address them or help them. But again, as our world of manual physical therapy, especially as we go into multi-system and integrative approaches, what our hands can do to identify old traumas, old injuries, old things, and actually restore some of the structure, and take some strain off the system, give the system an opportunity, the body an opportunity to work in its most opportune